All right. Good afternoon, everybody. Yes, me again. If you've been to this stage, you've seen me a few times today. Welcome back. I know that we're the last panel of the day here, and we're standing between you and the happy hour. So I promise we're going to bring great energy. We've got some great stories to tell. Thank you for joining us. I'm Keith Fredenberg from Chime. I have an amazing panel here. I'm going to ask each of them to introduce themselves in just a moment. But our session today is from tune-up to top speed. We're going to talk about how two health systems achieved cloud success. With that, I'd like to ask our panel to introduce themselves. And Curtis, let's start with you.
Thank you, Keith. Curtis Hendrick. I'm the Senior Vice President of Cloud Services at Optimum Healthcare IT. And we are an implementation partner that got the opportunity to work with these great customers.
Hello, everyone. My name is Jeff Volkheimer. I'm the Senior Director of Collaborative Technology Partnerships. I manage our relationship with Microsoft, and I manage our cloud governance and adoption teams.
I'm Alan Coleman, the Senior Director over what is referred to as Application Delivery Services, and I will call it the middle tier of the EHR with core Epic backend infrastructure and also our third-party applications, and happy to be here with my colleagues to share our journey today.
I'm Chris Paravati. I'm the Health System CDIO at Northeast Georgia Health System.
I want to thank you all for joining us. All right, here we go. We're going to jump in. We don't have a lot of time for today's session, so let's start with a little bit of context. How many here in the audience, by a show of hands, are currently in the process of migrating to cloud? Raise your hand if you're migrating. All right, a couple out there. Very good. Thank you for that. So you can see the data here. This is directly from KLAS. Many of you know KLAS. But I'm going to point out that the top two bullet points here, 91% of organizations, right, who are talking about moving to cloud or already gone to cloud. Why they're doing this? A, they want to reduce capital expense. I know that's a big issue for three of our panelists here, right, and address resource constraints. The resource constraint issue is not going to get better. It's only simply going to get worse. Curtis, what else is the story here? If you could tell us, what else do you see in this data here from Optimum's perspective?
Yeah, I think in all situations where organizations are going on a cloud journey, there's usually a reason why they're leaving and there's a reason why they're going. And so I think a lot of what's depicted on this is the burning platform of the challenges that they have of doing the same thing. But then there's also the capabilities that they're adding by doing the new things, right? And so there's the agility and the elasticity, and some of that's cost, some of that's like optimization through elasticity and things like that. But as technology is changing at an ever faster rate, organizations need to be leveraging technology that's more nimble to respond to the demands that are happening. So I think this definitely tells one piece of the picture, but I think the other side of it is that organizations are also adding capabilities on top of what they have today.
Yeah, awesome. So let's pull a little bit more on that thread here. Let's go to our health systems. With the Duke Health team, what was your why? What really motivated you to start your journey?
Well, all of these points really resonate with us. I think that some of them speak for themselves, and you really need to sharpen your pencils, especially when you're trying to explain how you're going to reduce those capital outlays and shifting costs to OpEx. But I think that, as Curtis was saying, we really recognize at Duke that we want to change our business from just pure run to transforming the way that we deliver healthcare. And part of that is adoption of new technology. So you can't just sit there isolated in your own data center the whole time and expect that you're going to be able to keep pace with the rapidly changing landscape.
And I'll add on to that what Jeff was talking about is that as Duke Health is expanding their geographical footprint, in order to be able to leverage and be able to be nimble about moving technology, applying technology to the business, is that being able to look at the capabilities of the cloud and have that allows us to manage that strategy going forward of going to that growing and transforming.
Chris, tell us about your why.
Yeah, similar. We started our cloud journey 2 years ago, and we're of a 3-year program. It started with really looking at our core infrastructure and what our end-of-life strategy is going to be. Our data center, our DR, what at the time was our DR site, and methodically thinking through what was going to be our cloud migration strategy, what were going to be the benefits, and these are real benefits. We're seeing we avoided a huge capital investment, right? We've normalized that, moved that into an operating expense that we can really see. We've taken non-production environments and been able to scale those appropriately, so not just always mirroring production environments. We've flexed resources that maybe were limited to just my team, whether it was Curtis or other resources. And we're seeing speed. We are seeing speed, performance, and it's now set us up to address things like our legacy Citrix environment, taking Citrix out of our environment, moving to a more contemporary delivery model that ultimately will continue us on a trajectory of being able to scale and really limit that cost and really be able to manage that.
So for the group, I just thought of this, right? Top of my head, so going to surprise them a little bit. Little uncertainty to the panel, but just thinking about healthcare is moving to the home, right? And consumers want to be met where they're at. How much of that, if any, was part of your why and your decision making when you're thinking about migrating to the cloud? Like thinking about consumers and where care is moving.
You know, I'll add to this right here. Actually, one of our executives for Duke Health happens to be sitting into the back of the room, who's thinking about that future, how you do the hospital of the future, how do you provide care for patients that are in there. So I wouldn't say it was our primary one that we were doing, but I do think we're keeping that in mind of how do you actually meet the patient halfway and make sure that you're providing that access going forward.
So some of your decision making was skating to where the puck is going, right?
Yeah.
Curtis, from your perspective, talking with customers, same thing. Is this what you're talking about as well?
I think in the future, people don't know what's going to come around the corner, right? Like AI is changing the game very quickly, right? Our demands and requirements are changing rapidly. And so organizations are realizing that they've got technical debt. And so when we look at home care, we look at hospitals of the future, we look at what the future interactions are going to look like in healthcare, shedding the technical debt and having the agility and nimbleness to be able to respond to those needs. That's where cloud has a huge value proposition. And I think organizations are seeing that they're actually in the process of not just modernizing, but preparing for what's going to come and what's going to be asked of them. I think a lot of this goes to what you're talking about.
Yeah, so we've got two health systems represented here who are deep into their journey, right? But the fact remains, we work with a lot of health systems across the world, and many aren't yet on that journey yet. So I want to ask both our Duke Health and Northeast Georgia to reflect on the beginning of your journey. Like, what were some of the preparatory things that you had to do in terms of building the foundation to start that journey? Right? Can we start with that? Chris, maybe we start with you?
Yeah, so when we went live, when I took this role, I did a big hardware refresh, a big investment in technology. And at that time, our system scale, we had a production environment and we had a DR site. And at that time, DR was not business continuity. It's a disaster, okay? And we're going to take care of patients, and we're going to stabilize the environment, and we're going to recover our production environment. That is no longer the business case, right? And so with that in mind, we really started with what is the architecture of the future that we want to create? What is our roadmap to fully value and expense out our current infrastructure? For example, I got crack units in my data center. They're going to go end of life in 2 years, right? So can I get those out? What's the plan? I don't want to replace those. I've got 3 generators. I can go to 2. I'm eventually going to go to 1.5. We'll see what that looks like. So it's the thinking 3 to 4 years down the road, understanding where the technology is, and then getting comfortable with what that is. And then it's really starting to understand the partners in that space to deliver.
I think that my advice would be that you really cannot underestimate the size of the tent you need to build in order to bring people into that journey with you. We love to talk about technology all the time. That's what Alan and I do on a day-to-day basis. But realistically, it has to be driven by the business. And you have to bring them along for the ride. And just showing them a spreadsheet a few times, showing how the costs move around, it's not going to be enough. You have to be really persistent. You have to do an internal sales pitch. And you really have to have that strategic vision that is going to outline a plan that will take you into the future. And you can't underestimate how long that's going to take. It's going to take a while, so you have to be patient and you have to be consistent.
I think that's a really good point. And one I'd like to highlight is we took the executive team through that whole discussion early on and said, we have choices. Here's the different choices. Here are the business decisions, the implications, with also just a standard of what we expected our technology delivery platform is. So a really good point.
And when you're looking at one of your migrations, like moving Epic to the cloud, we shouldn't think of the finish line or moving Epic to the cloud as the finish line.
Right. There's a whole lot more in that stack.
There's
than
a
just,
lot more in that stack.
When 50 apps.
Right, and the new capabilities that you're adding as moving them to the cloud, and along with all of the third-party integrations that you have, you should look at it as a checkpoint of saying, what did we do right? What did we make harder? How can we adjust? How can we actually make sure we're providing technology for the future of growing that way?
Yeah, I want to pull on that thread just a little bit, right? Because we're talking about day zero stuff, right? This is what you need to do really before you get on this journey. Somewhere down the line, 30, 60, 90 days, whatever it might have been, you probably had an aha moment like, oh, gosh, if only we had done this on day zero, right, before day one, we would have been better off. Did you have one of those moments? And if so, what would it have been?
Well, I personally think that moment would have been, I should not have let the size of the problem overwhelm the team, right? There are a number of applications that are going to be pulled in Epic's wake if you're going to choose to move it to a cloud platform, and you can easily get paralyzed analyzing the size of that problem. Do not allow it to overwhelm you. You really need to focus. You got to focus on what's important and define those things, and then you go one step at a time.
And I would add on to Jeff and what he said earlier about the size of the tent is that you have different audience of going through there. You have, how am I going to afford this? And how am I going to sell this to the business? You talked about that. Being able to actually saying, what do I need to do in my current data centers from a technical perspective to be prepared in order to be able to move? And then don't allow your current policies and or your stance on things. How do we look at security? How do we look at compliance when you're internally within a single data center or across data centers that are on-prem? How does that change and evolve going forward? So several different audiences, and going back to Jeff's point is that it is not an IT project. It's bigger than an IT project.
I think the other thing, and Curtis and I have had a lot of conversations about this, is we overanalyze the amount of application layer testing that we needed to do, and we tended to take our traditional integrated testing methodology into our cloud migration, and it's not the same. And frankly, if it works and you can log into the application, okay, you haven't materially changed the architecture of the application, it's going to work in that domain. Now check how your interfaces, how your connection points, your client delivery, your peripherals. That's where you're going to spend your time. You're not going to spend your time revalidating if the application works.
Curtis, I have to ask, what's that one piece of advice you would offer to a health system, right, as they're doing their preparatory work? What's that one thing they have to remember?
Yeah, so they have to have the why, and they have to have the why clearly articulated, and they have to build an understanding within the decision makers and the community that's going to participate in this as to why they're doing this. Because there's a lot of cheese that gets moved in this process, right? People, the way that they've done things is going to change, and they have to understand kind of the nirvana, maybe it's not nirvana, but in the place where they're going and why they're going there. And so organizational change management, kind of 101 process, a lot of times people don't think about that when they think about something like a technology change, but it's just as important in this situation is that we need to ensure that everybody clearly understands the why, because there's going to be hurdles, there's going to be challenges along the way, and if we don't clearly articulate that on the front end of it, we're kind of doomed. We're doomed to kind of fail in certain situations. So that's what I would absolutely highlight. I
think one other thing, you've seen the Carvana commercial where the guy is trying to sell his car, his wife keeps going, not yet, wait, right? You've seen that commercial? It's the same thing with your cloud. And for the longest time, the senior team was like, should we be moving to the cloud? Should we be moving to the cloud? I'm like, not yet. We got a lot more infrastructure life cycle on this. Not yet. Okay, now, let's go, right? And it now is the time. The maturity is there. This is not, frankly, it's just like changing your infrastructure you did a dozen other times. It's in a different place.
So I want to move on a little bit. We've got some more data to share with you, but I want to pull on that thread a little bit more. How did you know when it was the right time?
Well, for us, it was as much a business decision. I think as you elaborated is, how do I make sure that $50-60 million worth of assets are being fully utilized to its maximum capacity, and I transition to that next platform at the appropriate time that gives me enough leverage that I can go, okay, I don't have to do this. Isn't the building's not on fire, but it's methodical and it's sequenced. We've seen enough. We've vetted enough. We've thought about reskilling our team. We have an effective partner, and we have a plan. And it wasn't solely my decision, but it was about orchestrating with each business C-suite level, CFO, everyone, chief clinical officer, about what it means and when and why now. And that's how we arrived at that.
And I would add to that is that at Duke Health, and Jeff can speak to this more, is we don't have a mindset of cloud no matter what mindset.
Right.
Where you need to make sure, because you touched on making sure you're filling in that gap and upskilling your staff, at the same time evaluating the technology, which one's appropriate to be on-prem, which one's appropriate to go to the cloud, and when do you go? Or you ask the $1 million question, when do you not go?
And it's okay to pull a go live. You know, I mean, I told my team, if you need to pull a go live, Stuart had the command, I said, pull it. There is no shame in it. As long as you're not impacting the users. This is truly an IT initiative on the execution side.
I think that swinging back a little bit in terms of like, how do you determine if the environment is ripe to make your move? Duke was facing a number of things. We knew that we were going to have to make a change, so we signed a strategic partnership with Microsoft. That obviously made the economics change a little bit for how we would make our migration. Secondly, we were facing supply chain issues just like everybody else was. So we had a few major changes we were going to have to make in our data centers, and we knew that we were going to have issues with supply chain, and we weren't sure that we wanted to make those changes. And then finally, we also could look out into the broader landscape and see that we wanted to have additional capabilities for disaster recovery and continuity. We knew we wanted to modernize the skills of the folks who are managing our applications. And this was a great reason to do that. So those three things came together, along with the other things that the other panelists have talked about, to create circumstances where it was right for Duke.
I think one other point on your selection, on your cloud selection. For us, we're a medium-sized community health system. Either vendor, AWS or Microsoft or even another, could handle our payload. It was not a question of could they handle our payload. It came to the matching the right vendor partner for what we were looking and how we were going to execute on that strategy. And so that was, frankly, it was an IT decision as to who was our cloud partner, with a strong recommendation of the executive team. And they largely trusted us. But I would challenge you to be objective in your cloud selection, because you will be surprised at the distinct differences in the business strategy of each cloud provider, and you will have to pick the one that matches your direction.
So I just want to reflect on, we've got some data in front of you here. This is from a recent Chime member survey. And Curtis, as I look at this, I think what sticks out to me, it's not the 3/4 who are on the journey. It's that only 25% roughly are actually in a place where they're fully migrated and they're fine-tuning and optimizing, right? What's the story behind the story here from Optimum Health IT's perspective?
Yeah, I mean, we use the term journey because sometimes it doesn't feel like it ever ends, because you're kind of perpetually on this state, right? Because every year when you complete the next thing, you can see kind of what's ahead of you and kind of what's the next mountain, what's the next accomplishment. What's interesting is that the organizations that are kind of saying that they're in the innovation and acceleration stage, right? They were the ones that moved the earliest, right? They were the ones that took the biggest challenge and the biggest risk. And in healthcare, healthcare likes to have company in their decision making. They like to feel like, all right, this has been proven. I've seen a number of systems do this. And we see this even just with Epic, right? It was, 5 years ago, it was like we had a couple. There was just a 1 or 2 or 3 that were doing this. And now, we've got huge amounts of organizations that are in flight and have completed their migrations of something so critical as Epic. And so I think the point there is that as the organizations continue to adopt and mature in this space, we'll see more of them shift to kind of the right side of that graphic. But I think that those are the folks that were the most bold early on, and were that took biggest risks early on, because 5 years ago, I don't think it was quite as certain that cloud was going to have the impact that we see that it has today.
All right, lightning round for our health systems up here before we go to the next. So, philosophically speaking, early adopter or fast follower?
Fast follower.
Duke Health?
Fast follower.
Okay.
Fast follower. Yeah.
All right, that's fair. So let's go on to our next set of questions here. So just thinking in terms of your journey, right? Your migration journey. What lessons have you learned during the process of migrating and the execution? And again, what advice would you have for those organizations who are currently in their journey at various different stages?
So I'll start with that. I think we have all three talked about being able to prepare the different stages. Selling it, making sure you're doing the why, selling the financial piece of it, your return on investment. What do you need to do as sort of prerequisites for you to be able to go? And then lastly, being able to have a good execution plan with appropriate partners in order for you to get there. What I would say for the advice piece of it is that it's all about clarity. And Optimum just so happened to have a pit crew as their particular poster if you swung by their booth. And so where we come from in North Carolina, I'm in NASCAR country. So I will do a race analogy here. And there's an old one that says sometimes you need to slow down in order to go faster. And the appropriate is that if you take care of your tires, you look at it as a journey, then you are actually going to be on the front end of that race than some of your others that are coming along behind you. And I think you have to do that same thing in your cloud journey of being able to say, prepare, slow down, and if we have to call a particular migration or slow down a migration, that's a good thing.
That's right.
Right? And for us to be able to work with our business, because the most important thing is to take care of our patients and make sure operational trust is still there.
Ellen?
I would add that I think that you don't be uncomfortable with a little bit of ambiguity. So Alan described how we select our applications to move to the cloud. We call it a cloud smart strategy. It is definitely not a lift and shift. It is nuanced. And people are kind of uncomfortable with that. The concrete piece of advice that I would give you if you are in the middle of execution or you're planning it is plan for cloud FinOps as you are executing. Because what that's going to allow you to do is to control your costs. If you do not do that, then you will be in a position later on where you will have overspent. And no one wants to be in that position. So in partnership with Optimum, we built a model that would allow us to project what our costs are. We have members on my team who are actively monitoring it, and we're right on target. But it's only because there's somebody constantly coming in behind the scenes saying, hey, engineers, we think we can get a better reservation price over here. We can move this around. That is a non-technical exercise that is sometimes overlooked.
Yeah, I think that's a really good point. This project's not over, right? You've got constant tuning. There is a new standard work, daily operations around really managing that and tuning. I am acutely aware of what's left in the data center that's not running production, and I want it turned down, right? And I'm watching that every single day because I made a promise 2 years ago, and I'm going to be held accountable to that number, and I want to make sure I'm driving to it.
So this journey, it's not a simple one, right? Requires meticulous planning, thought, preparation, adaptability, flexibility. So for our providers here, how crucial was it to you to feel like you had a true partner, right, with you on this journey? Not a transactional vendor approach, but because of how important this is, how crucial was it for you to feel like, hey, we've got a true partner in this, because you know there are going to be bumps along the way?
Oh, I think you nailed it earlier, right? Healthcare likes to travel in a pack, right? Why would I do something the first time that I've never done before alone if I could find a partner that could help me align to ensuring that outcome? That would be so arrogant to think that I could just do this alone, never before. This is not rack and servers. I mean, this is a different animal, and we had to retool, and I had to retool. And so, humility is your friend as you're thinking about taking on new technology.
I would expand on that to saying that our current staff, and Curtis and Jeff and I had this conversation yesterday about our current staff and what we feel like that we have as far as a skill set, and could we do this work? And the answer is yes. However, is that you still have a health system to run with hospitals and clinics and current operational stuff that you need to do. And with that, it has to do with focus that you were talking about, and are you giving people appropriate time in order to plan? So I think having a partner like Optimum coming in to help you guide you through those things and bring up is very strategic in being able to do it.
I would add one other thing. Sometimes you want a partner who's going to be a guide. Sometimes you want a partner who's going to be a therapist. And I think that Curtis here might be my therapist, because there's been a couple times where I've pulled up the phone and I've been like, hey man, am I losing my mind? Am I right about this? And he will say, actually, you're wrong. I'll be like, well, great. I really needed to hear somebody tell me the truth.
So, Curtis, question for you is, as you just heard that, right? Yeah. How important this journey is to these organizations and many others that you're working with, but the fact that they have a business operation, they have the business of healthcare to deliver. How much does that weigh on you and your team as you think about, yes, this is really important work, but also giving them the capability to continue doing what is so important to them and their communities?
I mean, that's why we're here, right? I've always worked in healthcare. I won't work in a different industry. And so I think at the end of the day, there's an altruism that exists and is part of the culture that, not only within our organizations, but I know within theirs about their purpose and reason for why they exist. And so at the end of the day, we're not doing this for cloud. We're not doing this for the servers. We're not doing this for the network gear. Like, we're doing this for patients, and we're doing this to make people's lives better. And so it's important that organizations have an aligned culture in those ways, right? And so I think that's something that's got to be, job one. That's got to be the first and foremost thing in terms of the motivation for why you're doing it.
And I think you just made a great point that I'd like to share, not only with our panelists, but all of you out there, right? This stuff is really hard. The business of healthcare is hard. And frankly, if it weren't for you, lesser people would have quit a long time ago. So thank you, right? This is your obligatory thank you. Thank you for what you do each and every day to try and move health and care forward. So I just want to put that out there, my PSA for the day. All right, let's look ahead to the future, right? Where are we going? What does optimization and innovation look like going forward for Duke Health?
I really think that it's about the investment that we have in our staff. That, in my mind, what I would really want to have is staff that are comfortable using these technologies. They know how to apply them to the right situations, and I could call upon them, or in some cases our partners, at any time and make the right decision for the patient.
And I will add to what Jeff has talked about. There's 3 key words that are in our mission statement: best patient care, education, and research. We look at it as we want our staff to be looking at, we are doing everything in our possibility to take care of patients today. We are applying technologies and methods in order to do research to take care of future patients better in the future. And we're also educating our clinical staff in order to take care of those patients. So that's what innovation and optimization looks like to us.
Chris, final words.
Yeah, what I would tell you is you cannot innovate if you do not have a stable environment. Stability enables you to give the discretionary time to focus on driving innovation and change in your organization. And if you're unstable, you cannot focus on any of those things. What the cloud journey has done is allowed us to build a core infrastructure and a technology tenant for which then we can drive innovation on, whether that's adoption of all the AI, because we had to say that at least once in his presentation, or bring on new automated ways of delivering, or delivering home health, or doing device integration. Those are all building on this foundation. And so this is the tenon for which then you can springboard that new work.
Well, let me add one thing too. Is I think kind of the end of the road here is the goal is to stop doing commoditized activities and doing differentiated activities, right? And so to Chris's point, you can't, if the commodity stuff, if the lights are getting turned off, you're not going to have the opportunity to focus on the differentiated stuff. And the ultimate goal, I think, with a lot of our organizations is to try to focus much more on what makes us unique and actually the business of healthcare rather than the business of servers and storage and compute, right?
With that, unfortunately, we are out of time. I want to thank each and every one of you for joining us here today. I hope you're having a great day at ViVE. I especially want to thank the Optimum Healthcare IT team for helping bring us all together. Please join me in giving our panelists a round of applause.